Hey everyone, Dr. Krystal Lynn Couture here from Pure Balance in Portsmouth, New Hampshire. And today I want to talk about the three pillars that I use when treating pelvic health in my pelvic care program. Okay, so the first facet is the biomedical or physical alignment. And when we're looking at the physical alignment, we're looking at the bony structure of the pelvis. We're looking at how the joints line up and how they're functioning. We're looking at the ligamentous structure to see what's happening there. Again, if we have balance or imbalance, we're looking at the musculature to determine what's happening in each side and concomitantly. We're also looking at the concomitant structures. So we're looking at the totality of the body and the tissues that connect to the pelvis that aren't directly the pelvic floor. So for instance, those muscles are going to be the glutes. They're going to be the posterior rotators of the hip. They're going to be the muscles of the back, the muscles of the abdomen, and even the muscles of the thighs. And these can make a really big impact as to what's happening in the physical body. We're also going to look a little bit at the physical function, which could include how the bladder is functioning, as well as the rectum, and what's happening with your symptoms vaginally or within the penis, right? From there, okay, so that's pillar number one. That's our physical manifestation. From there, we're going to look at the energetic and systemic composition. So essentially what that means is how those organs are functioning in relation to their jobs and in relation to each other. So if we think about the body as a kingdom, right? The heart is our emperor or empress of our being, right? And we kind of know that because we can lead with our heart, right? As we go out into the world, and the heart's where our passion comes from, right? In Chinese medicine, we call that the manifestation of our Tao or our purpose, the way in which we choose to live our life. So each organ has a function. Now, if the organs within this body kingdom aren't doing what they're supposed to, if they're not, like in the case of the bladder, if they're not managing the waterways or regulating the waterways, that can be problematic for the pelvic floor as well as the entire system, right? So we look to the function and the energy within the system. And we do that through looking at the pulses. We do that through looking at the tongue. These objective measures give us insight as to what's really happening deep in the system. And that's the source of the pathology, right? So we'll use the meridian points and the extraordinary vessels, other vessels in the body, the energy systems to help balance out what's happening in this body kingdom and really help to work with those organs, to tonify those organs so that they're awake and functioning as they need to be, or if they're in excess, to kind of turn them down a little bit so that every organ in the body system is doing its specific job that is lending to the totality of what's happening in our, body, mind, and spirit, right? So that's pillar number two, the body kingdom and the energetic, systemic approach. Pillar number three is going to be the emotional, spiritual sense of what's happening in the body. And so as we know, the pelvis is the root of the body, right? The sacrum is that really, really strong bone. It's sometimes actually referred to as the sacred bone. And that's because it is the root of our spine. Our spine extends from it and our limbs come off of it, right? And it's really, really the root of our foundation. So when we look into that, we can realize that the pelvic bowl and the musculature that surrounds it, so those concomitant structures, can hold emotions and can cause our spirit to be a little bit deficient in different ways. And so by working with the spirit and the emotions, we don't always have to name that. This isn't necessarily talk therapy, although sometimes that happens, but it's really about what the system is telling us and how we can start to move things. Now, in Chinese medicine, we often say that stagnation is the root of all disease. Well, that's particularly true relating to our emotions. So when our emotions are held, right, it requires energy for our body to hold those emotions. And there's only so much energy that's available for holding. It's holding it there to protect us, perhaps. And that's okay. Our body can hold that to protect us as long as it has the energy to do that. But at some point, as we age, we run out of energy to hold things latent, in particular emotions. So when we utilize the energy associated with the spirit and with the emotions, we can help to start, take the pressure out of the pressure cooker a little bit. And we have some amazing, amazing points that allow us to work with the spirit. So for instance, on the pelvis, we have a point that is called womb and heart diaphragm. This is one of my favorite points. It's a fabulous point to start to connect the heart and the womb, to repair that relationship. So for someone who has had trauma, for someone who has had heartbreak, for someone who has perhaps lost a child, or had a miscarriage or had an abortion, this is a great way to start to repair that connection. We believe in Chinese medicine that there's a vessel between the heart and the womb. And I think if we look at the emotions between the heart and the womb just on the table in a clinical perspective without having any research to back it up, so often I see that heart to womb connection being really, really valuable. We also have points like waterway, which are very useful when we're treating the bladder. We have points with the name stone gate, first gate. These gate points can make a big difference in helping to open the channels and release blocks in energy. So they can be very useful in that systemic approach, as we talked about, but they can also be really, really useful on the spirit level. So we can help to move the spirit, to move the emotions so that the spirit is contained within this physical body. It's held within this physical body so that we essentially are the manifestation of our spirit. That might be going a little bit ethereal, but what I have found over time is that when I bring the physical aspect, when I bring the systemic aspect, and when I bring in the component of the spirit, these are the clients that have the most success in working with me and improving their pelvic health. And what I'm looking for here is not an improvement that's short-term. I'm looking at long-term results. I want you to have a sustainable long-term result. And to do that, when we add these 3 pillars in, we can make such a big impact for your overall pelvic awareness and your pelvic health.